Sure. The FORMULA-509 trial was a randomized, multi-center trial looking at patients with a rising PSA after radical prostatectomy. These patients usually get salvage radiation with 6 months of androgen deprivation therapy. And what we were trying to find out in the FORMULA-509 trial is whether adding 6 months of Apalutamide and Abiraterone could improve outcomes compared to the standard of 6 months of Bicalutamide added to standard 6 months of ADT. So again, this was a randomized trial, and we looked for patients who had slightly higher risk. So they had to have at least some kind of unfavorable risk factor, like a high Decipher score, a Gleason 8 to 10, a pathologic stage T3, T4. We even allowed node-positive patients in. It turns out in the trial, about 29% of the patients were node-positive. And when we designed the trial, we stratified by PSA level and node positivity. So in the trial, the median PSA was 0.3, and about a third of the patients had a PSA greater than 0.5, which was one of the stratification factors. And again, 29% of the patients were node positive, which was another stratification factor. When we designed the statistics, we used one-sided p-values for the overall trial. However, for the pre-planned, pre-stratified subgroup analyses, we used two-sided statistics, which I'll get into when we talk about the results.